another episode of our Forefront of Future Frontiers, the medical webinar series. And today we are in series 14, which is exploring priority areas in public health. And today's episode is episode number 91. And I welcome you all for this session. And today we have with us Dr. Kavita Vasudevan, who is the head of Community Medicine Department at Indira Gandhi Medical College and Research Institute, Pondicherry. She'll be talking to us about research in public health areas with a focus on mixed methods as the tool for study. With this short introduction, I would request Dr. Our Dean, Dr. P.F. Kotur, to welcome the gathering and Dr. Vishnuvat to introduce the speaker. Over to you, Dean, sir.
Yeah, thank you, Professor Mahalakshmi. First, let me welcome Dr. Kavita Vasudevan for this FFF platform on behalf of the staff and students of AVMC and also from our management, Honorable Chancellor, Madam Chancellor and the University at large for this 91st episode of this FFF webinar. And our resource person today is probably quite aware of these uninterrupted webinars for the past almost 2 years. So, and we are heading towards the 100th episode of this FFF webinar. And this for the past couple of webinars on this platform, they are related to the public health. And I don't need to emphasize the importance of public health and the related public health research, because public health is a multifaceted one. In a sense, it's a broad discipline interfacing of the medical science or medicine with the social science, then the management and many other fraternities. So, and public health determinants are also variable, multiple variants are influencing the public health. So when you want to undertake growth of any science is possible only if there is a research in it. It is quite essential for any science, including this public health. So in a multifaceted discipline or a broad discipline which has got an interface of social science, medical science, management science, etc., the research obviously will be not as simple as that of some quantitative research or a clinical research, that kind of a thing. So it requires different methods. Into the interface means social sciences, mainly the qualitative research will be taken upper hand. And in these medical science, the quantitative research. So you need to have a combination, mixed method. That's what Professor Kavita will be dealing today, the mixed method of doing the research in the public health. So you collect the qualitative data and the quantitative data, two methods, two separate methods. Each has got its own advantages. Of course, limitations too, you have to keep in the back of the mind. And for the good of the mankind, for the good of the public health, you undertake the research exploiting the advantages of each of these qualitative and quantitative research. That's what I think in layman terms, what I understand by this mixed methods, and which is required. Now everything our total curriculum is community-oriented education, community-oriented teaching. These kind of things have been taking place, metamorphosing the medical education. So this is the right time, that the teachers or the faculty will have a knowledge of this. We are required to do educational research as well, which is again a qualitative research. And apart from being mandatory by the regulating council, doing a research, producing papers for one's own hierarchical enhancement, that is a different issue. One more thing is we all have opted to be the teachers, and teachers, it is our duty to give evidence-based education, evidence-based patient care. So unless you give evidence-based patient care, evidence-based public health cannot be practiced. So the demands of the community are also changing, and many of the public health interventions, we know, many of them do not have the sound scientific database, but they have been in their place and they are giving good results also. These areas have to be explored by these mixed methods. And one more thing that comes to my mind is the concept of the philosophy of action research. Action research has got in the social science, the upper hand, wherein doing research and simultaneously and doing a critical thinking and trying to find out solution to the problem you are facing all go hand in hand. That suits very well for the doctors or the clinicians or the teachers. So that is the action. Therefore, you are trying to find out a solution while by critical reflections and solve the problem then there itself, so that you will facilitate or you will make the total process of your teaching learning effective. So introspection of your own teaching learning methods, your own patient care practices, and you halfway through you find out, encounter some problem, research question you define, try to answer then and there itself by your ability to do a critical thinking. So these are some of the things that come to my mind, and it's quite interesting. Only thing is one should try to get involved, because if you are just superficial and outside, it will be like hearing from one ear and going to another ear. You should get involved, especially I am talking to our students, etc. There are a lot of students, undergraduate students, postgraduate students. They are trying to involve themselves in the research at various levels. It is at the need of the hour. So these some thoughts. With these few thoughts, I think that's enough. I will request Professor, my colleague Professor Vishnu Bhatt, to introduce Dr. Kavita. Over to you, Dr. Vishnu.
Respected Dean Dr. P.F. Kothur, our Dean, and Dr. Mahalakshmi, Dean at PE, all faculty members, senior, juniors, dear students, and all our guests of Friday evening. It's very nice to introduce Dr. Kavita Vasudevan to you all. She was one of our students, MBBS MD, she did from Tikma, and now presently Associate Professor of Community Medicine at Indira Gandhi Medical College and Research Institute, Pondicherry. Before that, she worked in PIMS, and she's also worked in AVMC. So she's senior to us, all of us in AVMC. I think she worked for almost 6 years in AVMC before joining Indira Gandhi Medical College. And she has got a lot of experience in research, funded, non-funded students research. So she has completed more than nearly a dozen of funded projects, and I think half a dozen she's doing now. And she has made a scientific contribution in various national and international journals. She has been examiner for PhD. She is also doing community-based studies. I think our special interest is injury to women, household violence or domestic violence. I think very major issue, especially alcohol becoming cheaper and more easily available, maybe one of the reasons. And she has also done studies in relation to diabetes and other common problems. And of course, qualitative, quantitative, now I think the mixed method has come out in the last few years. I think that the terminology is little new, maybe last maybe a decade old. Before that, there were quantitative qualitative research people were doing. I think there is a new thing, and there is a lot of scope for people to do research. And many times people are stuck up with how to analyze the data with regard to qualitative research, because quantitative research you have numbers, percentage, then you put statistical test, whereas when you come to qualitative, there may not be absolute value sometimes. It is only the grading, or you put numbers, whether good, bad, or in between, something like that, sometimes it may come. So I think it will be very interesting, and the input from this presentation will be useful to the faculty and students. So welcome you, Dr. Kavita, and back to Dr. Mahalakshmi for continuing.
Thank you very much, sir. for that nice introduction. Before I hand over the stage to Dr. Kavita, I'd like to request all participants to keep themselves muted so that the audio quality remains good for everybody. And I also want to inform the participants that this program is being telecast live in YouTube, and we are recording it for posterior academic use. Dr. Kavita, you are the presenter now. Please go ahead.
Thank you, Dr. Mahalakshmi. First of all, I would like to thank the Dean of AVMC for giving me this opportunity to speak this particular session. It's a wonderful program that you are organizing. I believe this is the 91st episode of the FFF webinars. I too have attended a couple of the sessions and found them very interesting. I'm very happy to be here as a resource person for this particular session. Moving on to my presentation. Is my screen visible?
Yes, ma'am.
And I'm audible?
Yeah, no problem, madam.
Right. So my presentation today is on mixed method research in public health. I would be firstly talking about why mixed method research has emerged. As Sir rightly said, it's new in the field of research, and why has it emerged? It's the first part of my presentation. Then we look at various designs, study designs in mixed methods, and we would also see what are the methodological considerations that we need to keep in mind while doing mixed method research. To give you some examples of some studies on mixed method, and finally, how to analyze and write the mixed method research in a brief. So, to start, I'm sure all of us have seen this picture, elephant and blind men. The idea of showing the picture here is that each person, each of these blind men who touch the elephant, decipher in their own understanding what it could be. Similarly, while we are doing research and we are looking at a health problem, we are only looking at some aspect of the health problem. To look at the complete picture, sometimes or most of the time, a single method may not be enough, may not be true. So while we are doing research, these are the 6 questions we always ask. What is the problem? What is the extent of the problem? Where is this problem happening? Who are the people who are getting affected? When does it happen? And audio? Ma'am, am I audible?
Yeah, you're audible.
Right. So these questions of what, where, who, and when are usually addressed by quantitative methods. We also have, sometimes we need to find out why is this problem happening, or why, for example, why do people prefer a particular health facility, or how do people perceive the services provided by one particular health facility. These problems may not be in the domain of quantitative methods. We may have to look at qualitative research to answer these questions. But basically, we always deal with the 6 questions when we are talking about research. I'd like to start with an example, a hypothetical situation with a real public health intervention. In one of the webinars in a couple of weeks ago, Anil had spoken about the TB program. And one of the public health initiatives that were initiated was the Nikshay Poshan Yojana, wherein TB patients get rupees 500 per month for the duration of their treatment by direct beneficiary transfer. Now, suppose as a program officer or as a researcher, I want to find out whether this public health intervention has been effective. Did it do what it's supposed to do? Did it reach the correct people? How to evaluate this particular public health? So I had 2 researchers who came forward. Okay, one was researcher A. He had a quantitative approach towards this particular research problem, and had another researcher B, who took qualitative research methods to assess this particular problem. So after their research was over, researcher A reported that totally rupees 2 crores have been dispersed. 85% of the TB patients have received at least one installment of the direct beneficiary transfer. Time taken from treatment initiation and receiving funds range from 42 days to 172 days. That is within the second month and within the completion of treatment.
Dr.
Average.
Kavita, 1 minute. I think there is some background noise. Fan is rotating or some sound is coming.
Right.
I think there is a fan, ceiling fan sound which is coming.
Right. I just check.
That rhythmic sound is coming in the background noise.
Okay. Can I just stop sharing or?
No. It's the video is all right. I think your audio, there is a background sound is there. Maybe the ceiling fan is on or something, which is producing a rhythmic noise.
There are two devices or something.
No, not two devices, sir. It's a fan noise which is coming.
Is it okay now?
Much better, madam. Much better.
Right. So shall I go back to my presentation?
Yes. Make it full screen. Yeah. Sorry.
No problem. So like I said, to evaluate this particular program, two researchers came forward. One used a quantitative method and one used a qualitative method. The researcher A, who used a quantitative method, gave these findings. These were his findings, that time taken was around 42 days to 172 days. There was an average weight gain increase in all TB patients to a value of about 6.5 kgs. Success rate was 92%, death rate was 3%. Researcher B came up with this particular finding. They said she narrated stories from the field. One TB patient said, I received money 2 times, but it was very useful for me as my father had a stroke and the money was needed for his treatment. Sorry, I'm not able to move forwards. Yeah. Another patient said that he did not have a bank account, so he did not receive any benefit. And the third person, STLS, who's a program staff, he said that there is a delay in release of funds. So I have ensured that at least everybody gets one installment. Now, from this example, do you think that the person who used qualitative method has come to a conclusion that this program is working? Is it correct? Or the person who used the qualitative method said that doesn't look like the program is working as it's supposed to. So such a situation always arises, and as a program officer or as a researcher, we need to look beyond this dichotomy. We need to look at the data and see not just the numbers, but also the reasons, the perceptions behind these numbers. So that is where the program, that is where the mixed method research designs come into play. It combines the power of numbers from quantitative data along with the power of stories from qualitative data and helps us to have a better understanding of the research problem. Right? So in a mixed method research, the researcher collects and analyzes both qualitative and quantitative data rigorously in response to the research questions and the hypothesis. He integrates or mixes or combines the two forms of data, both qual and quant, the data as well as the results. He organizes procedures into specific research designs and provides a logic and procedures for conducting the study. It frames these procedures within the theory and the philosophy of mixed method research. This helps to understand both the breadth and the depth of the problem. So this, by definition, is how we look at mixed method research. Now, mixed method research has two components, qualitative and quantitative. And as a layman understands it, he always says quantitative methods use numbers, whereas qualitative methods talks about feelings, describes perceptions or views of the participants. So what exactly, quickly we'll just look at the differences between these two. Quantitative research has a post-positivist perspective. That is, they believe that the reality is one, there is a single truth, and they have a theory and they go ahead and try to prove or disprove that theory. Whereas qualitative research has a constructivist approach. That is, they believe that truth is constructed by people individually as well as collectively based on their experiences, based on their perceptions. So you can have multiple realities. That's the basic paradigm regarding qualitative research. Quantitative research is considered to be objective, can be counted, it can be assessed, measured, whereas qualitative research is more subjective. Quantitative research speaks about cause and effect, risk factors, associated factors, whereas qualitative research looks at perspectives. Quantitative research tests hypotheses, whereas qualitative research is usually used to generate hypotheses. Quantitative research has a predetermined sample size, which is supposed to be representative of the general population, whereas qualitative research, the sample size is dependent on data saturation. We use probability sampling techniques in quantitative research, whereas non-probability sampling technique, we'll see what they are in some time, is used in qualitative research. Data that is generated in quantitative is usually numerical, whereas qualitative data are textual, visual, can be conversations, etc. The tools used for quantitative are questionnaires, whereas most commonly used is a questionnaire, whereas for qualitative, you can collect qualitative data through interviews, through observations, through discussions, through journals, audiovisuals, etc. The analysis is usually statistical analysis, which deal with numbers, tests of significance, etc. Whereas in qualitative, we look at generating themes from the data. Quantitative research aims to provide internal and external validity, whereas qualitative research looks more to be credible and to be transferable. So these are the common methods, qualitative research methods as well as quantitative research designs that can be combined together in a mixed method design. So in quantitative research designs, we have descriptive studies and analytical studies, whereas in qualitative research methods, we have case studies, ethnography, grounded theory, narrative approaches, phenomenology, or description. So what exactly is the philosophy behind these qualitative, quantitative, and mixed method research? The research community is supposed to be, divided into three. The researchers who believe in quantitative methods, researchers who prefer qualitative methods, and researchers who like or prefer mixed method designs. Now, mixed method design is called the third community in the research community as such. And the principle or the philosophy behind each of this is what I would just spend a moment on. In quantitative research, we are talking about post-positivism, where the logic is mainly deductive, and we are talking about a single truth, which is for which a hypothesis is made, and you go ahead and prove or disprove that hypothesis. Whereas in qualitative research, the approach or the philosophy is constructivism, where the truth is generated as perceived by the participants. It's also called exploratory research. And when you generate theory from the given data, then you have the grounded theory, which is developed. Mixed method studies or mixed method research philosophy is more pragmatic. It looks at what works to get the answers to the given research problem. So it uses both deductive and inductive logic, and it integrates both qualitative and quantitative data collection and data analysis methods. So in this, uh, you know, spectrum, we should ask ourselves, where do I place myself? Personally, I initially was more of a quantitative researcher in the beginning. Usually happens, the newer, the younger ones are usually have a quantitative, approach or orientation. But as you come across more and more, you do more research or you look at more health problems, my orientation is more towards the mixed method study. So, but why do we need to mix? Why isn't quantitative research methods enough, or qualitative if quantitative doesn't work? Why do we need to mix? There are 5 methodological reasons given for mixing methods in mixed method designs. One is to deepen and enhance the other data, that is to complement. Suppose we collect information from quantitative research methods and we want to enhance or deepen our understanding of that method, we can do a qualitative component to it, add a qualitative component to it to understand it better. We can expand the inquiry to ask a different question. Suppose we find something from a qualitative research and we want to find out, is it exactly a problem? So we can expand the inquiry to ask a different question. Sometimes we need to develop newer instruments to assess a particular health research problem. So in that, we can use mixed methods studies. We can use mixed method study to triangulate or to collaborate the earlier data from different sources can be compared and integrated to have a better understanding, or to initiate or to resolve the earlier contradictory findings. Suppose we find different findings from qualitative and quantitative, we can identify why exactly is this happening, like in the examples that I mentioned before. So these are the 5 methods or reasons for which we mix methods. So when do we choose to mix qualitative and quantitative methods? Suppose your research question finds, or your research question focused on a need to obtain more complete results, then you can choose a mixed method study design. Sometimes if you find some findings from a particular study and you need to explain it further, then you can choose a mixed method. You first need to explore before administrating an instrument, or you want to enhance an experimental study with a qualitative method. For example, you do a clinical trial and you find out that this particular drug is better than that another drug, but you want to know what the participants experience through a qualitative method, you can use a mixed method study. Sometimes we need to describe and compare different types of cases. We need to involve patients in the study, like Sir was telling, action research, participatory action research. Sometimes we need to involve the participants in the study. That time we can use mixed methods. Sometimes, or if there is a need to evaluate, implement, or develop a program, then we can use mixed method study designs. So when we are talking of mixed method study designs, we usually mix qualitative and quantitative data. So how do we mix it? We can collect qualitative data and quantitative data and mix them or integrate them at the time when you are analyzing the results. Or sometimes we can connect the data. We can collect qualitative data, use the findings from that to identify what more we need to understand, and then collect the quantitative data. This is very useful when we are developing questionnaires. We develop a questionnaire, then we test it. So questionnaire is developed using qualitative data and we test it using quantitative, or the other way around. Suppose we have quantitative findings and we want to understand it better, we can do a qualitative component following it. So we can connect the data. Either we merge it or we connect it, or sometimes we can embed it. Like for example, I told you about the clinical trial. If you want to find out what is the experience of the participants in the clinical trial, so qualitative data can give you a better understanding. Yes, the drug works, but what is the experience of the patients? Will they actually, are they happy with the experience, or are there situations or issues which can affect compliance to that particular treatment? So the mixing of qual or quantitative can be either by merging or by connecting or by embedding. The as other study designs, mixed method study designs are also mentioned. These are the three basic mixed method designs. Actually, as Sir said previously, this is an evolving field. It's been mixed method design, study designs, or mixed method research has come into force in the last 1 or 2 decades only. So it's still evolving. Actually, one of the first workshops which I attended maybe a decade ago, we had more mixed method designs. But as the evolution of this research methods are happening, the most recent stand is these three basic mixed method designs. One is the convergent parallel design, the other is the explanatory sequential design, and the third is the exploratory sequential design. We'll look at it in detail in a few minutes. There are other terminologies or designs you may come across when you read literature. So I want to mention it here. Though they are not considered the basic, they are a mix or variations of the basic designs. You may have an embedded design, like I mentioned in the clinical trial. You had previously triangulation was also used or mentioned as a mixed method design. You have transformative designs when your mixed method design is incorporated within a theory. You have multi-phase designs where you first conduct a quantitative and then a qualitative and then a mixed method or any of those combinations. Then participatory action research is also one of the forms of mixed method designs, and program evaluation design may also. These are considered say advanced forms of mixed method designs. But for the sake of completion, I have mentioned these. If you look at mixed method designs, the basic ones are those three mentioned in the previous slide. So the convergent parallel design, what is it? Here you collect quantitative data as well as qualitative data at the same time. Okay? So it is not one after the other. You're doing it simultaneously. This data is being collected, quantitative as well as qualitative data is being collected parallelly. So once you collect and independently, and once you collect the data, you compare and relate the findings from the qualitative and quantitative and see if your findings are similar or different. If it is different, then maybe you need to explore further to find out why exactly is it different. If it is similar, then it helps in a better understanding of the current situation, and then you give your interpretation. So here, your quantitative data collection could be in the form of a questionnaire, maybe self-administered or interview administered, and your qualitative data collection maybe through interviews. It may be an in-depth interview, or you may even conduct focus group discussions depending on what your objective is. And then the data is analyzed separately, and then compared, integrated, and then interpreted. So this is an example of a mixed method study design, which is of a convergent parallel design. This was a study or public health intervention done in Odisha. As you can see, they did a intervention in 36 villages to improve the sanitation. The program was called Sundaragrama, and they had these interventions. They had skits, transect walk, community meetings, wall paintings, mothers meeting, etc., etc. And they evaluated this program by using this particular mixed method design, okay, parallel design. So the qualitative data was collected through activity observation and in-depth interviews, whereas quantitative data was collected through surveys, records, and end of trial surveys. And then both the results were merged to find out and interpreted to find out whether the program was effective or not. The second design which I'm going to talk about is the explanatory sequential design. Here you start with a quantitative data collection. And once you collect the data, you look at the quantitative data and find out some questions which need to be, or some areas, some issues which need to be explored further. And you determine who are the people or which sample you need to identify for the subsequent qualitative data collection. So first you do the quantitative data collection, then you identify people whom you need to include in the qualitative data collection, and then you do the qualitative data collection, and then you try to explain the findings of the quantitative data through your qualitative findings. So initially you could have a survey, and then once you do the survey, you may identify people who require more, whose opinions or perceptions you need to explore more. You can conduct in-depth interviews with them, and then based on your findings, qualitative findings, you can explain what you have observed in your quantitative methods. Let me give you an example. This was a mixed method study designed using explanatory sequential method. This was done in Haryana. Here, they looked to evaluate the NRHM program. So the program was initiated already. They collected the data in the form of outcome indicators of the program. And then at the end, once they found out the outcome indicators, they did qualitative data collection at the end after the quantitative data was collected. Okay, and this qualitative data collection was done among all the stakeholders, both the health care providers as well as patients. And then they tried to explain whether how effective the NRHM national program has been in reducing the maternal and child health disparities in Haryana. The third exploratory sequential designs which we may have heard of is goes this way. You first have a qualitative data collection analysis, then you build, you form or develop a questionnaire, and then you test that questionnaire. So when you are making a questionnaire, you usually collect information from key informants. They may be subject experts, they may be content experts, they may be important stakeholders, and you try to identify the points which need to be included in the questionnaire. Once you make the questionnaire, you test that questionnaire in a larger population through a survey. So here you are actually trying to generalize the findings of your qualitative study through a questionnaire to a general population or larger population through a quantitative method, and you are interpreting whether these parameters are the right way to assess that particular health problem or research problem. Give you an example. A mixed method study to develop a resilience scale for Thai elderly with chronic diseases and depression. So here, first they interviewed six participants and identified the areas that need to be included to make a questionnaire to assess the resilience, and then they tested it on around 300 elderly people to find out how many of them had chronic illness, diseases and depression. So this is a commonly used method, not just in public health, even for development of many other questionnaires. We generally tend to use this particular approach. So when we are talking about mixed method designs, we use certain notations just to clearly identify what we are talking about or which design we are talking about. So when we use uppercase like this, QAL is quantitative, qual, and QAL is qual, qualitative. So when we use uppercase, it means more emphasis or importance is given to that particular part, either quantitative or qualitative or equally. If we use a lowercase, it means it is of less emphasis has been given in that particular design to that particular strand. If a plus is present, then it signifies a convergent design, whereas if an arrow is shown, then it means it's a sequential design. So we say quan plus qual, it's a convergent design in which both quan as well as qual are both in uppercase, so they have equal emphasis. In the second one, if you can see, qual is in caps, so it has more emphasis. It's a sequential design. So from qual, you are having another qual, maybe it's a quan here, smaller, which says that the emphasis is less. Sometimes for showing an embedded design, you can use parentheses or brackets, right? So this notation is commonly used. If you see, then just by looking at that, you know which design is being used. Okay. So just to sum up the designs, the first three are the basic designs. Convergent designs, you have qual and quan. In explanatory, we have quan and then you have a qual. In exploratory, we start with a qual and then we do a quan method. In embedded, you may have a quan, which is a small part of a larger qualitative study, or you may have a qualitative part, a small component of a larger quantitative study. Transformative, like I told you, you have quan plus qual and qual within a framework. Okay, and multi-phase, you may have multiple single method or multi mixed methods in sequence. So how do you choose a particular mixed method design? It is chosen based on these 5 criteria. First is your rationale. Why do you want to do this study? Why do you want to use a mixed method approach for this particular study? So your answer is, I want to develop a new instrument. So yes, then you can go ahead and choose exploratory sequential design. No, I want to have triangulate the data from qualitative as well as quantitative and have a better understanding. Maybe I can use a convergent design. Or I want to expand or improve my understanding of a particular situation. Like for example, one of the studies we are doing right now is about self-care practices among diabetic patients. So we looked at what are their practices and we identified people who have poor self-help practices, who scored low on that particular. So we looked at their self-help practices by a quantitative method. We identified people who had poor scores. So those people with poor scores, we interviewed them and tried to find out what are the reasons why they are having poor self-care practices. So it helps me understand better what are the knowledge gaps in self-care practices. So it expands my knowledge. So I used a sequential, explanatory sequential method. So the first criteria when you choose a mixed method design is to first identify what is the purpose of your study. Second, to find out the timing of collection of data. Do you want to collect data together at the same time, or you are planning to collect the data one after the other? So if you are planning to do it at the same time, okay, or you can do it sequentially. Similarly, what priority do you give to each of this quan and quan? Are they of equal importance? Okay, or does one strand have a higher or more emphasis when compared to the other? So if you combine priority as well as the timing, you can have concurrent designs with equal priority to qual and quan, or concurrent design with a higher emphasis to qual and then a smaller quant component, or importance to quan and a smaller qual component. Similarly, in sequential methods, you can give equal priority, or you can give more priority or dominant status to one of the arms, right? So this will also determine which study design you need to choose. Another important aspect you need to keep in mind is, when do you want to integrate the qualitative and quantitative data? Do you want to start with a research question separately for qualitative or quantitative data? Or do you want to integrate the qual and quant at the time of data collection? Or do you want to integrate at the time of data analysis and interpretation? Suppose you want to integrate at the time of data analysis and interpretation. Usually we go with the concurrent parallel design. Okay, because data is collected in qual and quant separately and then mixed at the time of data analysis. If you want to integrate at the time of data collection, then maybe you need to use a sequential design. Suppose you want to identify, collect data from qualitative data from few of the people who have answered in the quantitative data, then you use the explanatory method. Or suppose you want to test an instrument, then you can use the exploratory design. So, having spoken about mixed method designs so much, we also need to know that what is not a mixed method design. Just because you're collecting qualitative data and quantitative data doesn't mean that you're doing a mixed method research. Okay, so any quantitative method with a collection or analysis of qual data which does not follow the rigorous qualitative approach, then no, it is not a mixed method. So you need that scientific rigor of the design, whether it is qualitative or quantitative, to go ahead. Suppose you are collecting data through a survey and you also do a FGD. Doesn't mean that you're doing a mixed method unless you integrate the data or you justify using both methods for collecting that data. Sometimes people use combination of quantitative methods and call it mixed method. No, it is not. It is called a multi-method design, where you use a combination of different quantitative methods or different qualitative methods, or a qual without integration. So sometimes you just collect quant and quantitative data without integration. Then it is not mixed method. For example, we have questionnaires. We have 30 questions, of which 25 are structured, and we keep 5 questions at the end for open-ended, so that people can write what they feel or their perceptions and all. So unless you justify the use or justify why you have included those questions like that, or integrate that information with your analysis, then it is not a mixed method study design. So you need to understand that integration of data, either at the time of planning the research question, or at the time of collection, or at the time of analysis, is important to distinguish it from a mixed method design or not. Okay. Another terminology which is commonly used along with mixed method is triangulation. Usually people say, oh, mixed method means triangulation because you're using different methods to collect the data. Triangulation is basically an approach which you collect different types of data from different sources, from different people analyze it, or you use different methods to analyze it. So, but triangulation as such is not considered at present as a mixed method design. Like I told you initially, yes, it was included as a mixed method design, but now the Journal of Mixed Method Research Design also recommends that we do not use this terminology. Triangulation initially, actually, if you see the history, it initially started with qualitative data, because qualitative data was so subjective. They needed to provide a better perspective, so they used to collect similar information from a quantitative source and try to triangulate that. That's how it started. But please remember, triangulation usually just compares, but it does not integrate the data as is requested or as is expected in mixed method design. So triangulation can happen at the level of data. You can use different sources of data. You can use different investigators to collect the data. You can use different methodological approaches to analyze that data. So these are different forms of triangulation. Coming to, now that you've chosen your design, you have to decide how you will select the participants. Sampling techniques that are used in mixed methods are a combination of both that are used in qualitative as well as quantitative. So in mixed methods, they use probability as well as non-probability sampling techniques. The probability samplings are these 4 types: simple random, cluster sampling, systematic sampling, and stratified random. Most commonly, when we do a survey, we either use a cluster sampling or a systematic sampling. not going to go into details because it will cut on my time. But these are the common forms. In simple random, you randomly choose the participants to be included in your study. In cluster, you randomly choose a cluster which is a well-defined geographic area or a particular region, and then include everybody in that cluster. In systematic, you have a sampling frame and you decide how many people you want, and then take that many numbers every 10th, 20th person, like that. In stratified, when you have different strata and you want representation from all, you randomly choose, you divide the strata and randomly choose participants on each of these strata. Okay, so these are probability sampling techniques which can be used for the quantitative aspect of mixed methods. Non-probability sampling techniques are convenient sampling, that is when the participants are conveniently available to you. You're taking a class and students are there and you include them. So that's a convenient sampling. Consecutive sampling, one after the other, whoever comes, you take. Purposive sampling, that's the most commonly used sampling technique in qualitative research. Quota sampling, when you have, you want to ensure that each quota, it's something like stratified sampling in probability, similar to that, here we have quota sampling. And snowball sampling, when you ask the participants to identify the next participant who will be eligible to be included. So these non-probability sampling techniques are usually used for the qualitative aspect or qualitative part of mixed method study designs. So when you're doing a mixed method study design, you have to, in your sampling sample size calculation as well as your sampling technique, you have to mention for the quantitative component what sampling technique you are using, for the qualitative component what sampling technique you are using. So if you look at the two commonly used sampling techniques, purposive for qualitative and probability sampling for quantitative, these are the various features. In mixed methods, we use both qualitative as well as quantitative. We use purposive for qual and random sampling techniques for qual. The important point to remember here is that for the qualitative component of mixed method, the sample size is going to be small and it is going to be determined by the level of saturation that is achieved. Whereas for the quantitative aspect, the sample size is usually larger and it is predetermined before the start of the study itself. The purpose is that you understand the breadth of the problem, whereas to understand the depth, we use the quantitative part. The selection of participants into the qualitative component of mixed method is based on an expert's judgment, whereas when we talk about selection of participants into the quantitative part, it is based on your mathematical calculation and your sampling technique. So in mixed method research, we use both the probability as well as the non-probability sampling techniques to recruit participants into the study. So how do you determine the sample size? The sample size for the quant is determined based on the standards for quantitative research designs. That is, what is the minimum size of sample that is required to correctly identify the difference, or to have enough power to make it generalizable. Okay, so the various techniques we use for sample size calculation for quantitative is used for the quant part of mixed methods. For qualitative part, we start off with the people, identifying the people who need to be included, and the sample size is not fixed, and we keep collecting the qualitative data till data saturation is achieved. But at the same time, we also need to look at feasibility. Do we have the time? Do we have the resources? Do we have the enough people to do that particular study? So your sample size is based on the existing norms itself. There's nothing different from mixed method studies. There are certain ethical issues also you need to keep in mind, apart from the issues that are there for qualitative or quantitative research. If you're doing a trial, then you have to keep in mind all the ethical issues involved with the trial, when to stop, when to how to ensure there is bias is minimized, how to randomize, all those things. For qualitative research, you need to ensure that you inform the participants that you're going to record, you're going to audio record them or video record them, depending on what you're going to do. Then another ethical issue that you need to keep in mind while doing mixed method design is to ensure that are you the right person to do mixed method study design? Because if you do not have the skill set, then it's not ethically right for you to start that particular, to adopt that particular study design. So ensure that you have a team of members who are trained. If the principal investigator is not trained in mixed method, but he is aware or well aware of the methods in both quantitative as well as quantitative research, can be justified. But definitely he needs to have at least 2 members in his team who can help him with both the quant and the quantitative. Next thing is, it may not be possible to ensure anonymity in mixed methods, because suppose you're doing a sequential, if you have adopted a sequential design, then you may need to go back to the patient. So you need to keep identifiers so that you can identify which patient to go back to and collect more in-depth data. So it may be, this has to be informed to the patient, as well as it should be mentioned in your ethical review component of your protocol. Then you may also need to contact them again and again. So that permission also you will need to take. And the burden is more on the patient, especially if they are not well, for them to be a part of the study. So these ethical issues you need to keep in mind, apart from the usual ethical guidelines that you need to follow while doing any research. Now, coming to the data collection tool, the quantitative data collection we can do through questionnaires, through checklists, and through reports, whereas the qualitative data collection can be done through discussions, focus group discussions, interviews, in-depth interviews, or key informant interviews, through observations, through documents, through even you can use audiovisual materials, you can use journals, photographs, etc. So qualitative data collection depends on which approach you are using, right? So these are the methods, or these are the tools that you can use to collect the data. Coming to analysis, the quantitative data, you have to do the statistical analysis, whereas for qualitative data, we do something known as thematic analysis. I'm not going to go into detail, but just briefly mention what it is. So quantitative, we all know, we express the data in means and standard deviation, proportions. We apply tests of significance if there are tests, comparative groups. We do a bivariate analysis. We can even try multivariate analysis. So same thing can be done for the quantitative data that is generated in the mixed method design. Qualitative data analysis, you need to first prepare. You need to make the transcript. If it's in a different language, local language, then you need to translate it, ensure that it is translated validly, and then read it, code the various similar sounding structures of the transcript, then connect those codes, identify categories, then bring categories together, identify themes, use themes to understand why the behavior or the perceptions, and then think of ways in which you can reduce that enormous data and display it in a understandable way for a common man. Then qualitative data analysis, we usually try to identify codes from the transcripts and bring together similar codes to identify the categories, and then the categories lead to formation of themes. So in mixed methods also, when you're doing the data analysis, we need to look at quantitative data, the way it is done, as well as qualitative data analysis also has to be done the similar way. But the important point is integration. How do we integrate? Yes, we analyze qualitative data, we analyze quantitative data, but we need to integrate. So when we are looking at a convergent design, when you're doing a qualitative data collection and quantitative data collection simultaneously, then the conversion happens at the stage, or the integration happens at the stage of data analysis. So we try to look at the findings of qualitative inquiry as well as findings of the quantitative part and see whether it is giving similar results. If it is similar, then it is like supplementing or complementing the existing understanding. If it is divergent, or if the views that have been obtained by the two methods are different, then we need to explore further to find out why exactly is it divergent. Sometimes researchers, what they do is they state this divergent view as a limitation because they do not have the resources to do further exploration. But ideally, the correct thing to do would be to look at reasons why there is a difference in the qualitative and quantitative findings. Then coming to the representation, how do we do that? We can do it side by side. That is, first you mention the quantitative findings and then tell the qualitative findings, and then give the mixed method findings, saying that whether they are divergent, whether they are similar. Okay. Sometimes you can even transform. Researchers have tried that. Transform data. Like for example, they give numerical, they assign numerical values to qualitative data. Like they count how many times this particular theme has come or this particular category has been mentioned, and then do the quantitative analysis, or it's called quantitizing the qualitative data. Similarly, you can transform a quantitative data into qualitative. That is also tried. Not so commonly done, but yes, it is also one of the methods. Most commonly used method to display or to publish data from a convergent design is a joint display. I'll just show you a picture. Sorry. Yes, joint display, where you have the quantitative findings being shown in one side along with the qualitative findings being shown next to it. Similarly, this way, the scores or the under various headings as well as the qualitative data in the form of narratives, right? So that is how you can analyze, integrate the data and then display it. For sequential designs, where you have qual first followed by a quant, or you have a quant first followed by a qual, you find the first you describe the first component. Okay, if it's a exploratory, then you first describe the qualitative aspects of the study design, and then move on to the quantitative. Here, the purpose is to identify, to develop a questionnaire. So you can then move on to your quantitative and tell how well that instrument has been able to capture that particular construct. If it's a
Excuse me, we are almost near time, and there is a lot of interesting questions in the chat box for us.
Yeah, ma'am. This is my, I think, last two slides, two more slides to go. Right. So, so how do we write it? We have two components, both qual as well as quant. So how do we write it when you are writing a thing? So you can either weave the qual and the quant together. For example, you identified one particular topic, and in that you tell the findings from the survey, percentages, and then give reasons in the form of qualitative data as narratives. So you can weave it this way, or you can do it contiguously, that is one after the other. First you state the quantitative findings and then you go to the qualitative. So this is how you can write. Okay, so this I already showed. So what are the challenges in mixed method design? Challenges are whether, firstly, whether the researcher does have the skills to undertake mixed method design. Does he have a team which can help him in conducting? Does he have the time? Do we have enough time to conduct a mixed method design? Suppose it's a very small, short duration study. Do we have that much time? Do we have the resources, software, money, funding, etc.? Sampling and analysis issue, which how to, where to go, whom to include, all those things. And most importantly, educating others. Like mixed method designs are still in their infancy or adolescence. So many journals are not very happy at accepting mixed method designs, especially the qualitative aspect of it. So sometimes you need to educate others about mixed method. That's a challenge again in doing mixed method research. So the last slide here, the mixed method research in public health. Yes, mixed method research is used very commonly in educational research. Actually, even our projects, we have done many educational projects where we have mixed method design. In public health also, it is very important, it is vital, because public health deals with complex situations, which includes policy making as well as delivery of interventions. And we need to have a better understanding of the society, which may not always be possible in numbers. There are social determinants of health which cannot be counted. They have to be understood. And there are expectations and perceptions of the user, the community, which will actually decide whether they utilize services or not. And it helps understand human behavior. And it is very, very important in implementation research, in participatory action research, and in program evaluation. So finally, to sum up, these are the features of a mixed method study design. I think this covers most of the things that I have covered. Yeah. Thank you. Any questions? I would be more than happy to answer.
Yeah. Thank you, Dr. Kavita, for that very nice session. And you got most of the things right, and there are a lot of questions. And what I kind of, you got us hooked on into the webinar early itself when you said that we actually, source is not a single source of truth. Truth is not singular, and there are multiple realities, like Spider-Man coming from Spider-Verse, exists in this thing. And there was one particular issue which you keep talking about is about the exploratory research design. One Dr. Prashant Gowda, who is there in the meeting, he would like to know, how is the so-called survey research different from exploratory design?
Yes. See, when we do a survey, it's most commonly we are doing a quantitative research. We take a instrument, the survey instrument, mostly it's a questionnaire, and we administer it to the participants who are eligible based on your inclusion exclusion criteria, and we try to quantify it based on the responses. But when we look at exploratory, it has two components. One is the qualitative as well as the quantitative. Most common example that I would give is for development of a questionnaire. So if you want to, suppose you want to measure a particular construct, say I want to measure empathy in students, I do not have a questionnaire for it. There are questionnaires available, but they are not relevant in the Indian context. So I want to make a new questionnaire. So I developed that questionnaire by doing a qualitative research, that is in-depth interviews with key informants like, say, subject experts, psychiatrists, or even participants, and then come up with a questionnaire which includes all the points that have come. And then I test that questionnaire in the community to see whether it actually measures. And there are many ways of ensuring the validity and reliability of questionnaire, how to assess the content and construct validity and reliability. So that can be done as a quantitative part. So there is definitely so when we do a survey questionnaire survey, we are sticking on to only one method. But when we are doing an exploratory, when we are using an exploratory design, we have two components of both qual as well as qual. I hope that satisfies the answer.
Thank you, ma'am. Dr. Vishnu Bhatt has got a question for you. Is it necessary for us to classify and specify the type of mixed method study which we are using various notations and all while conducting the study?
My answer would be yes. Yes. Because see, we don't want it to be just that we have used different methods for data collection. We want to show that there is a particular purpose in using two methods, and it will help us in better understanding. So we have these quasi mixed method designs where you just collect data but you don't integrate them. But if you are actually doing a mixed method, you always integrate the data. So definitely you have to mention which design you are choosing, and usually it falls in one of these 3 or 4 designs.
Sir, I hope she has answered your questions. Sir. And we have one question from Dr. Bharati. How do you validate this qualitative data? Is it generalizable to larger population? And there is one more question, which is from Arun Daniel, which is kind of taking on this only. How authoritatively can you say that the evidence generated from qualitative research study can be used for policy changes? So that is what is, these two questions I think are related. And if you can take it.
Right. Firstly, why do qualitative research? If you can get the same information from quantitative, then why are you doing qualitative? But the point here is that we do not get that kind of information from quantitative research always, especially when we look at perceptions, when we look at feelings, when we look at constructs which are not easily measurable, but definitely matters. So when we do, so that is the purpose of doing qualitative research. But qualitative research as such in its own philosophy does not, what do you say, have a particular goal in mind. It wants that information to be as rich as possible. Okay. Now coming to how to validate that particular qualitative research design. The term used is that we don't talk about validity, external validity, internal validity as we use in qualitative research. We talk about credibility. What the researcher has understood, or are the participants able to understand what the researcher wants to tell, and are they able to convey it to them, and has the researcher captured it in their particular, in the way they understand it. Okay, so that is credibility. Another point that is external validity, which is similar to external validity, is transferability. One of the limitations of qualitative research, or rather say advantages of quantitative research, is that it can be repeated. Quantitative research can be repeated. But for qualitative research, we don't look at repeatability. We want variety, we want richness of data, we need more perceptions. So yes, qualitative research findings can be validated if we follow the steps to ensure its rigor. For example, ensure that the person who's collecting data is trained. Ensure that the guide that you use is, exhaustive. It actually measures what's supposed to measure. And ensure that the data that you're collected is transcribed, translated, and then when it is being analyzed thematically by the experts, they are trained and they are able to come out with codes and categories and themes. If there is a disparity, then there should be methods to, or rather there should be ways to ensure that the disparity is ensured. So there are various ways of ensuring validity in qualitative research, which may not be as numerically, computed as in quantitative. But yes, but the qualitative data is definitely.
There is one more added or appendage to that previous question. Is mixed method study, which has more practical bearing in bringing about an action plan, especially in the area of public health? And can you share some experience, your own experience in this area?
Yeah. What a couple of studies we have attempted in our department, like I was mentioning one, we looked at self-care practices among diabetics, and we tried to use a sequential explanatory method. Okay, we looked at diabetics, we looked at their self-care practices, we used a questionnaire for that, identified those who have good in all the 7 domains of self-care, and we found out who are the ones who have good self-care practices, and then who have poor. Then we identified those, we selected those purposively, those who had poor health self-care practices, and try to identify why exactly they are not able to follow the self-care practices. So we found that either they were not aware, they were aware but they were not sure whether it's going to help them, or they were not in a position to, it required some more resources which they did not have. So there were many issues which could be handled at the program level, like for example counseling. It requires more counseling, more reinforcement, and that kind. Another study which we did was on sexual minority groups, and we wanted to look at their healthcare seeking behavior. So we collected healthcare seeking behavior through a questionnaire, as well as we conducted FGDs along with a few of them at their offices, and tried to see what exactly are the reasons for that. And we found that reasons were because they were not treated equally, or they faced some stigma or discrimination at the point of healthcare, where they were utilizing healthcare services. So they preferred certain centers and when compared to others, those kind. So definitely it has enlarged our understanding of that particular research question.
Thank you for sharing that. You said that when we talk about validating qualitative data, it depends on how rigorous is your method of data collection, but you also emphasized on how do you transcribe and take up for thematic analysis. So my question is there an SPSS equivalent software available which will help you to do all this?
There are a lot of softwares available for qualitative. You have Atlas DI, you have Innova, but a machine can do as much as it can do. But if you really want to, I personally feel if the my personal opinion again, if the investigators do find time and they look at the data themselves, their understanding is going to be much more richer in finding linkages, in finding in understanding the perceptions of the people than software. But yes, there are software available.
What I think that most probably data collection method, if it is not robust, then this problem will be there.
Definitely, ma'am. That's why it's very important to take your time and ensure that you have systems in place to ensure that data collection is proper. So your interview guide, the person who is interviewing needs to be trained, should be guided, and it's an iterative process. After first interview, you realize that some things you have not asked, or you have missed out, or it should be explored more. The next interview, you improve on that. So qualitative data has that advantage. It's not fixed. You don't follow the same thing every time. You can add more so that your understanding is better. But data collection definitely has to be robust.
Thank you.
Dr. Kavita, can I make a comment?
Yes, sir.
First of all, before that, I must say that your the webinar was explicit, very informative and very clarifying the doubts in somebody's minds about this. Wonderful. Congratulations you for that.
Thank you, sir.
And my comment is, doing a research in the public health is not the end. Now that research has to be translated into the end user. For translation process is by the critical appraisal of this mixed method of scientific research, which is amalgamation of qualitative as well as a quantitative. You know the difficulties of critical appraisal of the scientific literature of a qualitative data. Quantitative is, you are all quite familiar, we do it day in, day out, journal clubs. See, this qualitative appraisal, one needs to be aware, one needs to acquire some kind of competencies, then only the good outcome coming out of this qualitative research can be utilized for the benefit of the community or public health. This is what just one comment I wanted to tell, because we are not familiar with the critical appraisal. We means the teachers, doctors working in medical college, we do conduct day in, day out journal clubs, but hardly any studies will choose from the qualitative research, and because the methods are quite different there, so that needs to be a little bit of sensitization of all the faculty has to be done. I hope you will agree for my comment.
Yes, sir, definitely, sir. And as I told before also, this is an emerging field. There is so much more evolving. So we definitely need to make a start somewhere. If not, at least one particular article being discussed in a journal club will definitely sensitize PGs, interns regarding qualitative methods as well as mixed methods,
yes,
apart from quantitative.
Thank you very much.
Thank you, sir.
Thank you, Dr. Kavita. Sir, Vishnupat sir, do you have any comments, feedback, suggestions, questions?
Yeah, it was a good talk, but I think the issue is more complicated than I thought. And we had qualitative, quantitative, mixed, now mixture of many things, so AVL of different combinations. So sometimes it may get confused for the person who is not exposed to this type. And when you do qualitative research and make a close end, it becomes again quantitative. Only when you take a qualitative data and analyze, then it becomes really qualitative, I think. See, many times in qualitative data also, we give a grading or score, then you may convert into quantitative data and analyze. So, but this is a different type of thing. And as the dean and others have said, to mark and take a percentage is may not be possible. So you have to look at the outcome of your research and see how to apply in the real life situation.
Sir, our IRC can plan one workshop on critical appraisal of qualitative articles.
Sure, I think.
Yes, sir. And actually, I think Vishnu Bhatt sir nailed the essence of the webinar. What Madam was trying to talk about juxtaposition versus integration. No, so we need AVL rather than mixture. Mixture, everything is individual element, whereas AVL is all mixed element. So I think that's what she was trying to say. Thank you, Dr. Kavita, for that very interesting, engaging, and very useful lecture for and also accepting our invite and taking part in this session. Thank you very much. We enjoyed having you here, and we really enjoyed the presentation and the interactions we had with you.
Thank you, sir. Thank you, ma'am, for giving me this opportunity. I'm also happy to be here. I think many people from our institute are also participating in this webinar. So thank you again. And I look forward to more such sessions for which I can be a participant.
Thank you. And before we close, I would like to tell the participants that we will continue our pursuit of trying to identify priority areas in public health. And next week, we have another very interesting webinar. We are going to talk about the human cost for road traffic accidents in India. And we have somebody from the Tamil Nadu Accident and Emergency Initiative, TAEI. So this is a brainchild of the Tamil Nadu government, and which has come up with a lot of innovative ideas and schemes how to reduce how to cash on the golden hour and to reduce the morbidity and mortality associated with road traffic accidents. So we have with us Dr. Marudu Durai, who is a vascular surgeon and medical superintendent of the Thanjavur Medical College. So he is the current coordinator for TAEI initiative, and he is going to talk to us about the human cost of road traffic accidents. So that is the webinar for next Friday. I hope you would all find time to join us in that webinar. On behalf of the Scientific Forum of Arupadavidu Medical College, a constituent college of Vinayaka Missions Research Foundation, myself, Dr. Mahalakshmi, Dean, Health Professions Education. Thank you all for attending this webinar. We'll see you again next week. Okay, stay safe. Bye-bye.
Thank you.
Thank you.
Bye.
Bye, sir.